Hello, world. Welcome to Speed Strength Show. I'm Tommy.
I'm Braden.
And I'm Dr. Robb, also known as Robb. So my expert question to you guys is, has sports sciences gone too far that biology has not kept up with yet?
Ooh.
Can you elaborate a little bit?
So science has done a lot to advance speed, power, performance. We can track outcomes, load management strategies, all these things. But are we still playing with the idea that we're still limited with the fact that biology, physiology are rate limiting, that it doesn't advance as fast as our understanding or what we think is our understanding of performance? Because injury rates haven't changed much, right? If not, we're actually creating a new era of science, which is in recovery and load management, which never existed years ago. So baseball being a big one, but other sports are starting to enter into this realm, basketball being a popular one as well. But science is evolving very quickly, but physiology isn't. So from your standpoint, like where are we at this point?
One of the first things, at least for me, that kind of sparks in my brain when I think about sports science is sort of when you were mentioning about have we gone too far, is almost like, not that exploring is a bad thing, but have we maybe explored too much? And now we're thinking about so many things that potentially factor into sports performance, injury rates, things like that. And are we potentially losing sight of what's the most important thing that relates to injuries or performance and things like that? So At least for me personally, I always talk about trying to, navigate all the factors at play and decide what's the most important. And I think maybe sports science and just research in general at times just overloads people with information to the point where it's maybe confusing for individuals and practitioners and stuff like that.
Yeah, that's a good point, where you have so many variables you can't really focus on. Well, you can't focus on the most important thing. And I think with anybody, if you have like a to-do list and you've got like 1,000 things to do and you try to half-ass every single one of them, you're not going to do any of them well. You know what I mean? So then you don't get the result out of anything that you're looking for. So, I mean, yeah, it probably does make sense to pick a couple that you think are important and focus on that. But the other thing that I thought about was kind of like, if you do feel what are the important things and you try to like dig into those and specialize in those really, really quickly, then you kind of lose the sort of general athleticism. And I just think like now, especially a lot more kids are starting to specialize in sports younger and younger and younger, which I think then becoming too specialized, you lose the ability to solve problems in different ways. You lose the ability to move in different ways, which is going to result in more injury risk as well, I think, anyway.
And I agree with both of you on it. And I think that it's a complex topic. Yeah, I don't think there's a straight answer. And it's you got to look at history a little bit too, right? Like you look at injury rates, and I'll use baseball again. Look at the injuries that are occurring now in this current era, and you look at what was not existing 20, 30 years ago. And the question becomes, are they better athletes than they were today? Depending on your operational definitions. But why are injury rates different, if not more exponential now than they ever were? When baseball players, so here's a prime example to it, they pitched 300 plus innings every year, right? Went out 38 times a season over a 6 to 7 month season. Now they go 180 innings, maybe two, not 300 guys, 200, and maybe get 35 starts, but they have scheduled off days. But their injury rates are higher now than they ever have been. So are we looking at the problem in the wrong way? Or is it just science is that good, making athletes that much better, more optimal when they do go out and compete than they ever were, right? And that's where, like, for me, it's just like, how do you answer that? How do you tackle that? Do we have enough science to actually address that? As it was alluded to by Tommy, it's like maybe science has gone a bit too far and we haven't been able to filter it enough to actually understand, okay, this is what the basic essence of things, right? We just keep steamrolling through topics and not actually being able to narrow that knowledge gap between field and science in the labs to actually be able to disseminate it, that knowledge dissemination aspect in a more proficient way.
Well, I guess that's a good point too. Like, to consider that athletes nowadays might be better, like potentially more output, more wear and tear on the body in less time, less, reps. And I guess the other thing, if load management and that sort of stuff is becoming more of a thing, I was listening to a podcast a couple weeks ago and they were talking about people that are not healthy. You want to reduce the load to get them healthy and prepare them for games and that sort of thing. But then I'm also, the other side of that is maybe you need to have them be doing more work and become more resilient, to the whatever is stressful, so if they're starting load management and that sort of thing younger and younger and younger, maybe they just can't tolerate the workloads that, would.
Such a fine balance, right?
Mm-hmm.
Yes.
Enough work to be resilient, but not enough to overload somebody and blow them up.
Yes. And how many S&C therapist, coach wants to put the primary objective of the season is for tissue resiliency, right? At the potential concession of you're not going to have the highest output just yet, but you're going to be healthy, right? Like, where is the conversation lost about longevity in a career with these guys? And I think that's like, I deal with that with some of the agents. Like, the goal is like to have a career. That's where you're going to make your mark, the legacy or money or whatever the motivation is. And it's just like, guys just want to like get max output, right? Hit that 1RM, hit that velo, hit that whatever performance outcome at all cost. Because then, well, how do you sustain that? And there's athletes out there that are really transcending a lot of that topic. Tom Brady comes to example, even Roger Federer. Like, there's hallmarks in there and examples of, like really good examples of that are like, what are we missing here? Because there's some great athletes that have really given us a template, maybe to model or even just to explore.
Well, I guess that's the thing too with pro sport is there's always like the next man up, so whoever survives is going to be, the star, the one who's making all the money and stuff. But
it's a dog eat dog, right?
Yeah, that's right. And if I look at people like Tom Brady or LeBron, or I don't know too much about baseball, but I imagine there's some people that have been around longer than others. And it's the ones that are like, they're taking care of their body, or they're continuing to refine their game and become more and more efficient, so that even as their body declines, they don't need to push to get the output that they need as much. Like I've heard NFL experts talking, like Tom Brady now apparently is throwing harder than ever because he's worked with a throwing coach that's smarter than the ones he worked with before.
There you go. Yeah.
Yeah, it's definitely, like you said, such a complex thing, and a question that I don't know if we'll ever actually get to the bottom of an answer. And you talked about the injury rates in baseball. I mean, there's how many studies now that's been done with track and field and soccer and rugby on hamstring pulls and hamstring strains, and the rate or the occurrence that they happen at hasn't changed, despite the fact that we've poured all this time and effort into looking at the rehab mechanisms and this and that, which means we clearly haven't figured out exactly what's going on because we haven't had an impact on the injury rate in that particular case.
And maybe too, like Bonza, the infamous studies is Bonza, when they did a lot of the injury surveillance research on NCAA athletes across all sports. And that's where that statement comes out of. And it's what I find intriguing is that if we are that good at making athletes that much better, that much healthier, and that better at competition, isn't that part of the outcome? It's like this dualistic approach where you get high outcome, but you're going to break down. And it's like, and I always use the analogy with athletes, like you're a race car. Like that race car is never used again in another race because it was so finely tuned for that race to give it the max output that it breaks down invariably because of that efficiency. Is that not necessarily what we're actually creating? Right? Because is that car ever used again? Like I'm not a Formula One guy, but that car is used for parts. right? They're always fine tuning things. So it's like, maybe that's what we're creating. And it's just like, you got to concede, maybe that's like one of the ultimate outcomes. If not, you have a better science team to actually sort of, okay, well, how do we keep you intact? And maybe it's not going full throttle. It maybe it's not being that optimal, but being efficient optimally long-term, not being sort of efficient optimally in the short term with the maxed output. You know what I mean? And obviously certain sports, I think, would sort of be sort of excluded from that statement. Like powerlifting, for example, like you got to show up today. You can't just say, yeah, you know what, I'm just only going to go at 95 today. Like that's not going to hold any water in competition. But in sports where there's volume and it's not more like baseball is 162 games. Powerlifting, there's what, how many meets in a season potentially at a competitive level? Maybe a handful potentially. Yeah. So you need to be there and show up on time for those. So, and maybe it's like sport to sport and also to body type that sort of attracts that sport. You're not going to see too many 350-pound dudes showing up to a baseball game to pitch for you, right? Nor are you going to actually see in a powerlifting competition a 6'5", 180-pound dude trying to let go max squat. Like the sports are sort of dictating some of the athlete types, right? And the body types, which then genetically would sort of predispose you to certain ailments, if you will, or sort of performance outcomes.
Mm-hmm. Yeah, I mean, that's a good point too. Like I remember hearing a stat about the NBA where like 1/4, I guess, of 7-footers in the world are playing in the NBA now. And is that because people are getting taller? Probably not. It's because, you know, people who are tall find the NBA, you know, and it's like that with any sport. But yeah, I mean, that's all stuff that you have to consider, you know, when we're looking at assessing an athlete, which is something that you deal heavily with. Obviously, everybody listening knows that there's more than just two voices right now. So Dr. Andrew Robb, Robb, I met him through the Armory, which is the clinic that he treats out of right now anyway, because I had many, many issues playing sports. And fortunately, most of the time I came back to see Robb, it was for a different issue, not the same one. And yeah, I mean, very, very smart, definitely formed or helped form my thought process in working around injury training athletes. If you go back to the mentors and influences episode we did very early on, Robb will come up in that for sure. But yeah, so he's worked as a sports chiro for Laurier football, Waterloo baseball, pitching coach for Waterloo baseball, Royal College of Chiropractic Sports Sciences research committee member, published in a number of journals and collaborated with organizations like the MLB, obviously very accomplished in baseball, as well as many, many other impressive things. So if there's anything important you think I left off, then Robb, take it away.
No, thanks, man. I appreciate that. I think you're over embellishing on my CV there. But no, I appreciate that, guys. The one thing that I sort of take on and take pride in is I try to gain perspective. Like, yes, I'm a sport chiro. My bias is in therapeutics. I played baseball, so I'm trying to get back to the game. Being around the research community, trying to stay first as best as I can. And some of my comment, that icebreaker was like, the rate of science publication is at an all-time high now. And it's trying to stay on top of it is a daunting task. And you guys know that. And Tommy, you're in your master's, like there's something new every day. And what I've come to realize is that with all the science, you have to be versed in multiple areas. You can't just be an S&C, you can't just be in therapeutics. You have to have some understanding in multiple areas if you're going to deal with athletes. And it's and understanding where your role is, what your scope is, but also too, it's just, can you hold a conversation so that way you can be a contributing member to that athletes network, right? And I think that it's hard for people. And I think that's one of the struggles and why I like these podcasts and coming on. It's just that, you know what, there are those such as yourselves, or you're trying to fill in those knowledge gaps and you're trying to gain perspectives and you're trying to educate people. And it's hard because not a lot of people know how to navigate through the science and the literature searches that can be endless at times. But it's one of those things where it's just like, I do what I can, and I feel like I'm behind most of the time. And it's and the more I read, the more I feel like I don't know enough. So it's one of those things.
Yeah, I mean, I think that's super normal. Obviously, we all feel that, but we're very thankful and grateful to have you on, because at least in my opinion,
Pleasure.
you're one of the most well-read people I know anyway. So to have your
Thank you.
guidance in some of this is helpful.
Yeah, I'm super stoked to have you on. So thanks again for taking the
right.
time, and I'm looking forward to getting to pick your brain a little bit here and
Perfect.
learn
Let's
some
do
new
this.
things.
Okay.
Yeah, the first question that we had for you was like, how do you see assessment? What is assessment? What does it mean? For me, I think it's probably arguably the most important thing that you can do with an athlete is get an understanding of where they're coming from anyway.
Yeah, you know what? It's when I first started doing assessments, it started off with the infamous FMS and trying to work through that and trying to sort of understand, like, hey, the athletes, there's limitations, and you come to realize that all techniques have their limitation. And part of it is they were designed based on a question that if it wasn't your question for the athlete, it didn't match. And that's why I always see in the science world, like, these techniques don't necessarily predict injury very well. So over the years, because of that, I've come to create these hybrids, and it changes every year more that I read. But I think also too, like with assessments, I think people become universal with them. Oh, I do this technique, or here's my scope. And it's not necessarily. And the point is that, like, with assessments, number one is the age bracket that's in front of you, right? And what level or what stage are they at in their competitive careers? Are you dealing with recreational? Are you dealing with competitive? And from that standpoint, you're trying to determine their state of athleticism, if they're in athletics. A, and B, it's just like, what is the most common denominator for all athletic capabilities? And that's like where I really try to sort of get to a basic premise. And here's the point to that. The assessment should identify, are they competent with the next phase in their training? Right? So everyone tries to look at assessments as like, are you prone to injury? No. That's not how that works. Because injury risk, as we just alluded to in the icebreaker, is multifactorial. We can't actually do that in one fall swoop in an assessment. That's not humanly possible. But we've tried to do that and it doesn't work. The idea then becomes, okay, I'm assessing an athlete, it's off season. What's the next phase in their stage in their season? Is it a complete off season deload and they're just going to rest? Are they going to play another sport? Are they going into the gym? Are they injured? Like, it almost becomes very tailored to sport, position, athlete, and then injury profile. So if I got a kid that's coming in the off season and he's hurt, that assessment has to look different than the kid that is healthy and just had a career year and is looking to expand on his off season. You can't do the same assessment because they're coming into the off season different. Versus you have, which I like working with, the sort of the developing athlete under the age of 18, where physiological age, rate of skill development, motor skill acquisition are all at varying levels, that you're now looking at a different assessment unto itself. But can you actually look at some common denominators on all brackets? Yes, you can. And here's the premise on it. The basic prerequisite for athletes to continue to improve is the nervous system competent with the next stage, right? So what does that mean? Well, if you're going to go into a strength phase, if you're going to do rehab, if you're going to do some speed work, if you're going to go play another sport, there's a degree that the nervous system has to now produce some output that the physical system has to now accommodate. Right. So if you get into Bernstein's work on movement construct and that modeling system, it was always about, is the nervous system matching the physical, and can the physical system bones, ligaments, tendons, capsule, fascia, whatever you want to call it, can it actually tolerate the outputs from the nervous system? And that's where I went back to complete basics, common denominator. Can their system actually do what the next phase is, right? And the basic sort of component to that is, do you have range of motion at that joint and series of joints to actually now produce output if the nervous system actually is going to give it to you for rehab, for sport, for training, whatever it may be. And if you don't have the basic prerequisites, it doesn't really matter what the next phase is, right? So then that's where assessments really, for me, came into play. And it became contingent on the age bracket. Are you 10 and under? Are you 10 to 15? Are you 15 to 18? Are you 18 plus? Are you skeletally mature at 25? Because those are going to look different. And the demands on that joint, demands on the nervous system, the competency of that nervous system are going to be different. And I basically use a lot of Bernstein's work on that, which is sort of one of the godfathers of movement science, number one. But number two, and the name escapes me right now for this podcast, and I apologize, but there was a systematic review done in 2019. And basically what they determined was the key variables that predicted skills in sports, sport-specific skills. And it's surprising when you actually hear the three. Number one was actually leg power across all ages. Number two was flexibility, range of motion. And number three was aerobic capacity. At no point in the regression modeling was more practice time, more sport time, and more sport actually predictive on sort of proficiency and skill development at later ages. So then you're looking at, okay, from an assessment standpoint, me being clinical, because I got to deal with athletes that are broken. I'm like, well, okay, assess leg power. Where are you at? It dictates stage of training, right? Which power requires range of motion and motor skill and coordination and agility, which are basic fundamentals in athletic development. And then from there, range of motion, well, that's therapeutic. That's also physical prep. And then aerobic capacity, well, that's a basic tenant in sort of neural competency, right? Like you need to be able to shuttle oxygen blood to working muscles, but also too, it's also your capacity to now recover, but also to do work in general and life stamina. Like you got to, this is all done in real time, guys. Like these athletes just don't, and especially the age of 18, just don't play sport and not do anything else. So they need that life stamina, that cognitive stamina to actually deal with life in general. And sport does that. So it's just, and that's where my assessments really came down to those common denominators, especially in the developing athletes.
I love that idea of assessing for the next step.
Yes.
Rather than, like you said, just having a blanket assessment where, hey, you come in, here's your score out of whatever, you're good to go, or no, you're at risk of injury or whatever. I love the idea that it changes based on where the person is going, because that aligns with everything else that goes on in training, whether it's sport practice, whether it's the auxiliary work in the weight room or wherever. We're always thinking about preparing the person for the next step. So I love the idea of doing that from an assessment or a clinical standpoint.
Mm-hmm. Yeah.
And part of it too is like you're trying to tell a story, right? So if the assessment dictates the next phase, that next phase can produce other outcomes or other questions that now need to be evaluated or assessed in this case. So your assessment becomes this ever revolving repertoire of tools to get to the next step. Are you competent and do you have the prerequisites for the next step? That's what an assessment is. It's not to determine outcomes of performance or injury, because that is like, now you have to include competition. You're not doing anything competitive in an assessment. So then the question is faulty right from the start. Just the inherent nature of the athlete sitting on the table, not in a game situation or in a competitive mode. So then you can't put injury on the table unless it's for the next step, right? And if it's relevant to that. So that's the idea there.
So then if the assessment is seeing if they are prepared for the next step, is the result from that assessment including something in their prep to get them ready for that prep, or is it telling you what they need to be doing next? Like, is it dictating what the phase is, or is it preparing them for the phase that already exists?
Both. So if you go through, like, and here's the most common one, range of motion. That will be the most commonly assessed variable across all stages, right? You need range of motion to develop rehab. You need range of motion for loading, and you need range of motion for competitive skill acquisition, right? So you need to know that, okay, well, what happens to range if I do rehab? Do I keep it? Do I not keep it? If I get into loading, well, what happens to it, right? Do I keep it? Do I not keep it? Can I tolerate it? Can I build resiliency into the tissue? Am I actually developing that attribute, strength or power, whatever it may be? And then when you get into competition, this is where it gets interesting. It's like, what happens to range if you compete? Which it begs a more important question is, how do you recover? And the point is that you recover based on what your body just went through, not because you just did a power lift and you're in a competition, or you just pitched 8 innings, or you just played a basketball game at a national level, or whatever the competition. Like the idea is that it's just that if it's range is the common denominator that allows you to create currency for adaptations, because if you don't have range, you can't adapt, right? And that's where the nervous system's abilities really become diminished, right? The question then becomes, do I need all that range, or do I only need a portion of it? Right? Like Braden, you know, is that like in powerlifting, you don't need to use all of that for performance, but you need all of it for tissue health and joint health. So the question becomes, why am I assessing range? Versus baseball, for example, where it's more of a speed-based, power-based sport, you need all of that range because you go into a paraphysiological space a lot of times. So what's the question you're asking in the assessment about range? And it's based on the demand on that range. So the question then, Tommy, to your point about like going to the next step, is that what is that demand in the next step? Right? Is that more prep work? Is it more skill acquisition? Or is it actually more to do just motor control? Right? And those are the commentary. You can call it like an S&C program, you can call it another sport, but what is the demand on the body? Like go back to a basic demand, like what's going on? Right? And then that makes it easier to ask the question, and then a lot more clear to actually, okay, well, what do I assess for? And sort of what's my recommendation, to your point, Braden?
So we know we need range. How, I guess, are we going about getting that range? Because I know like the systems feedback to each other. Like if you don't have range, then the neuro system's not going to give you the output, but then the neuro system is also kind of responsible for not giving you the range.
Yes.
So how do you?
Yeah. So yeah, it's that's a loaded one, dude. So here's the key to it. Like, why do we lose range?
It's a good question.
You don't use it?
Yeah.
So you don't use it, right? If you don't use it, you lose it. If you use it too much, if you abuse it, right? If you have poor motor control, if you're injured, if you have central fatigue, if you have peripheral fatigue, if you're metabolically sort of disrupted, right? Everything gets stiff, like you feel achy. If you have something pathological, like you have AS, for example, right? There are a multitude of reasons why you get stiff. So part of the assessment when you're looking at range is like, well, like what gives, like what happened, right? Everyone's like, well, you throw too much, or you run too much, or like your technique is off. Okay, maybe, but there's other reasons, and it's going to be age and gender and stage specific. And that's where, like, for me, like having the clinical background, it makes it a bit easier to expand on that list, right? The more you know, the more you can assess, right? And it can be a multitude of options. But the reason for that is, can you actually make a change? Right? That's the ultimate one. Like, okay, so what? You do it, you say you do assessments, you know, range is going to be a key variable. You identify something, well, so what? Can you do anything about it? Because if they have AS, maybe it's not in your scope. They got to be on medication. Versus you know what, it's a master's athlete and they have moderate to severe degenerative changes in that hip and they have what's called FAI, right? It's a mixed cam pincer. Like, well, can you do anything about it? No. The only thing you can really do is modify, and sort of surgery is the best option at that point. So the idea becomes, okay, well, what is it, right? Can I identify it? And what's my tools if I have the tools to make that change, right? Because that's the next step. Like, you're preparing for the next step. Or you like, no, you can't go to the next step yet. You don't have the prerequisites and I need to refer you out, or we need to expand our network for you and then go from there. But it's a multitude of reasons. But for the sake of the argument on sort of athletes and in a simplistic model, you will lose range if you don't use it. You will lose range if you use it too much. And if you get hurt, you do lose range. And if you're fatigued, of the various permutations on that. So then you got to determine, okay, well, what am I actually determining here, right? So if you don't use it, why does it get stiff? Well, like the muscle spindle, Golgi tendon, and all those mechanoreceptors, the proprioceptive profiling become desensitized. They're not stimulated enough. They're not adapting, right? Versus somebody who uses it too much. Well, why would they get stiff? Well, you get into sort of indigenous adaptations to tissue where they do hypertrophy, they do thicken, and they lose some visco properties where they become brittle, like tendons, for example. And then with ligaments, you see some afibral sort of orientations where they're not as resilient to tensile loads as much. And also too, with fatigue, with central and peripheral, like you get into some autonomic dysfunctions. But one of the first signs that you're fatiguing is stiffness. The nervous system can't keep up with the outputs that you're demanding on it. So then the physical system is reliant on whatever output you have left, right? So in part, like that stiffness can be an alarm system, but we deem it as a threat, not necessarily, depending on sort of how you want to look at things. Now, if you're injured, well, there's tissue disruption, there's scar tissue formation or lack thereof, depending on the tissue. And then you've got to now determine, okay, can I load this injured tissue that's compromised or can I not? And the idea is just like, okay, well, I need to be specific to the condition that actually now is the main contributor to why I am stiff and or why I do not have range, right? And that becomes challenging, and that has nothing to do with movement. That is like, look at the joint. Does it move? Yes or no? And if I make a change, can I keep it? Yes or no? They're very basic sort of tenets in that.
So I think that's the idea that stiffness is an alarm system is really valuable. And I don't know if people pay attention to that. I hadn't really thought about it that way. So that's definitely a valuable takeaway. And then the other thing that comes to my mind is how do we strike the balance between not using the range or using it too much?
Yes.
And how do we know which one's which? And
so a couple things. So you can put it into three sort of categories. Category number one is I need joint health, right? Full expression of synovial fluid and proprioceptive profile. GPS, if you will. Proprioception is like GPS, right? The more you use, the greater the abilities to actually work through your workspace, right? So there's that. So you need all that range for that purpose. The loading of that joint is now different. And that comes into two biomechanical sort of scenarios. Are you using the joint for speed? Or are you using the joint for strength purposes? So speed requires a sequencing of events between proximal and distal or distal and proximal, right? Top down or bottom up, right? And it's phasic. As one joint reaches full end range, the next one sort of sequences through its range and then so on and so forth. Versus strength, for example, it's all simultaneous. Everything fires and they got to load maximally all at the same time. Squat. I got 500 pounds on my back and I got to go, right? It could be 5, it could be 3, it doesn't really matter. The idea is that it's just like, what is the application? What's the next steps demand on that joint? Number one. And then from there, like, what do I need to do? If I don't know how to use it, then there's a fourth category, which is now motor skill acquisition, right? And sort of joint function, right? So the idea is I need it for health. Can I use it? can I load it with speed and or can I load it for strength? Because now, like if you get through both of those categories, then you're actually now completing the force velocity curve, right? And then intertwined with that is now the neurophysiology on sort of how you actually now accommodate for tissue loading, right? So that's sort of what it comes down to.
So then I guess for you, it's not about it's not necessarily about repetition. It's just about load in general, be that speed, be that force, be that repetition could be another thing.
Yeah, totally. I guess you could put into that speed and strength as like the conditioning component, right? Like if I have a distance runner coming in, like, well, they're going to take 10,000 strides in any given run. So can they actually use that joint in repetition? Mm-hmm. Right. So like, again, like, I guess there's that context to things, right? Like, so what's that next phase? What is the demand? Right? Speed, load, right? Frequency. And I guess you could argue the intensity, which is speed and load, would actually give you some suggestions on that.
Mm-hmm. Mm-hmm. That's a lot to think about.
Yeah, and then that's the whole point. Or like these assessments are not that simple. People mm-hmm. try to make them streamlined and simple. And I've been in these sort of discussion tables where we're looking at data and we're like, yeah, this is not predicting anything. I've sat through correlation matrices and I'm sitting there, I'm like, nothing's predictive. Mm-hmm. And it's just like, is it because these tests are useless? Or did we ask the wrong question of the test to the wrong state of the athlete at the wrong stage of their progression in their season? You know what I mean? And I think that's probably the bigger issue, where it's just like, okay, well, what's the basic premise of what we're trying to determine? Right. And ultimately, what can you control? Right. So as therapists, as trainers, S&C coaches, what do we control the most?
Well, right? The prescription of what we're giving them.
Totally. Right. That's it. But the athlete can only control, okay, can I move the limb? Can I position it? And can I load it? And can I actually do it under a circumstance in my environment, the constraint modeling theory? Right. And then the rewards that come out of that, if I do something right, what's the outputs, right? To reinforce that motivation. So, but that's it. Right. So then like you can't control injury rates. Right. That's the other element to it as well. We're asking questions of things that we can't actually control. Like on any given day, is there a world record broken at a championship meet? No. So then why are we trying to control for optimal performance when can we just provide the best proficient performance at the highest level that's commensurate to that competitive level, right? And go from there. Like prime example, the javelin, right? The gold medal was won with an 85-meter throw. The world record sits at 97, 98, and the world record holder didn't even make it, partly because of the circumstances of the environment, because he kept slipping and he just didn't qualify. So is it because the other guy won because he was better, or is it other circumstances, right? And he pulled his groin a little bit. So like we're trying to control for things that I don't think are sort of realistic in some respects. And that's ultimately what I'm trying to do. What can we really control for? And it's that prescription, as Tommy, as you allude to.
One thing I'd really like to ask you about some of the assessments or the way that you look at some of this stuff deals with asymmetries. We hear about this all the time, whether it's from clinicians or reading the research. And to me, it's a bit sort of muddied waters because within sport and training, you're going to end up with asymmetries. You talked about baseball. I'm sure every pitcher you work with is not a perfect asymmetrical left and right. They have a dominant side and they need a dominant side to throw.
Yep.
So I was curious, what do you do with some of your assessments in terms of what's too much of an asymmetry that you're maybe concerned about, but maybe what's not enough and you need, more strength or power or speed on a particular side because of what the sport dictates?
Totally. And you allude to it, like it's the sport sort of influences it, but I think the stage of the season dictates that. So if I'm going into the off season and I know I'm going to be getting under a bar because we got to go through some S&C stuff, you need symmetry. Right? It wipes out that conversation completely, in my opinion. Versus I'm starting the season. Well, you haven't done anything competitive just yet. and the asymmetries may not present themselves, so it's not a concern. It's when you're in the mid to late season where it's like, okay, now we're starting to see some asymmetries because you've logged in X amount of time in your sport, and now you're starting to see tissue adaptations indigenous to the sport. The bigger question is, and this is the one that sort of intrigues me, is that all assessments, and then I think Frost did this back, I think about 15 to 17, in and around that area. The rate at which we assess range doesn't always match what sport is actually loading on those tissues. So most of the stuff that we do is very slow and methodical and controlled. So if you're assessing an athlete in season, when they move at a high rate, you're going to actually perceive a lack of range of motion, right? So we'll perceive that as passive torque in the neurophys world, where it's like, is that really a bad thing? Or is it the rate that you're actually loading that tissue doesn't match what they've been actually training at? So their exposures, right, are different than what the assessment's actually doing. And there's nobody that's going to pick up a hamstring, a foot, and just crank on that leg as fast as possible just to mimic some of that loading pattern that a sprinter would have. That's not happening. So the idea then becomes, well, is that asymmetry basically sort of contingent in sort of a condition of where they're at in their season, that it just becomes a moot point? Like, no, that's not even a relevant question, right? Because like you said, baseball players, like they're going to have a lot of tissue density, hypertonicity, and adaptations on that throwing side. Prime example, guys, runners have thicker fascia on the posterior chain, 2 to 5 millimeters thicker than the general population. So they're going to be perceived as being stiffer. Is that normal? Yes, it is. But if you actually move them faster, you'll actually see they actually have range. So we're limited to the rate and magnitude of our assessment sort of techniques, that maybe it's actually not as bad as we think, right? Now, injured tissue is a different story when you get into some GERD and some of the total range excursion deficits, things of that nature. That is obviously that's there. But I think that like people got to realize, like, look at this, the pace of sport and look at the pace of assessment movements. They don't match. So then you're actually limiting yourself, right? And then your conclusion is being platformed based on something that may not be as accurate as you think.
Yeah, that's a great point about the specificity. And someone moves in their sport at, like you mentioned, well, I'm coming from a track background. I mean, you use the hamstring example. I can't think of anything other than sprinting that moves the hamstring at that type of speed. And there's no assessment I've ever seen done that, you know, would indicate somebody's prepared or not prepared for that type of loading. And exactly what you described, the number of times where I've been on the table or an athlete or somebody and there's a lot of tightness. Yeah. But like you said, totally. It's a product of what you need to do well in your sport. So I love that you've highlighted some of that stuff, because I think that's a great way to think about it.
And part of it too is like when you do perceive from a therapist standpoint, like passive torque or that resistance in the tissue, like remember, like tension is actually a modulator for proprioception, which is the key ingredient after range when it comes to motor outputs. When you get into the basic phys on sort of how do we actually move, you need range, you need tonus to actually now influence limb position, limb movement, and the contraction, right? To now guide movement patterns, loading capabilities, performance, whatever you want to call it. So then it's just trying to modulate, okay, well, is this good or bad? We're going back to the original question. So yeah.
So quick kind of pivot back and forth. I think we talked about you need the range and then you need to be able to control that range. So before you can have the speed and the load.
Yep.
And I think when people think about controlling a range, it's being able to move at any speed through that range. But if you're dealing with a sprinter or a jumper or a pitcher that can only get into these ranges moving very, very fast, like, is that control to you? You know what I mean?
Yep. It's I used to use an analogy, and it used to be with the old race cars. And during drag races, what they used to do is like the wheels would spin out and then it would fishtail, and then take off. It finally find a straight line and go. So engineers found a way to weld a restraint into the back end, so that way when the wheel spun, there would be torque. It would contain sort of that sort of range, if you will, and it would go off in a straight line, right? It minimized excessive range. So our brain actually does that. So the idea is that as the season goes on, your body molds itself into, if you will, like I use that word loosely, into positions, ranges that are optimal for sustaining performance, right? It's called degeneracy. Basically, what your cerebellum and your brain do is it narrows the number of options on the way to move, so you could optimize the one that is constantly at high threshold, which is, in this case, sport, right? The brain naturally does that if you constantly give it the stimulus. Degeneracy is a way to degrade the number of options that you have the way to move, so that way you can sustain yourself. The question is, what is the lifeline on that, on the tissue, so that it stays resilient? Nobody has an answer to that. And that's where constant assessing, like, okay, is this range for performance? Is this range for health? Is this range for training? Is this range breaking down? Right? And then going from there. And I think that's the part there that, remember, the body will keep going or adapt or maladapt based on what you do or don't do when it comes to that range. But that degeneracy is a huge component that people forget. Like, if you keep going, the body will mold itself. If you keep doing bench press over and over and over again, your shoulders will round forward and they will not set properly, right? The body's like, that's the option you gave me, so that's what I'm going to give you. So then if that's the case, so if you go back to the athlete, entering into the off season, they have rounded shoulders, they had a great season, there are no injuries, and they're stuck and they're really stiff. Well, the body just had only the options to move forward. It didn't do anything going backwards, because that's not what the sport required. So what do you think the next step is going to be? Gain all your ranges back, so that way you can then go into a training program that works all ranges, so that way you stay healthy and move forward. You just can't stay in the one state all the time, right? Because you get into some neural complacency and then the body starts to break down. The tissue doesn't actually have enough inputs.
So it's always kind of like a push performance and then correct, and then push performance and then correct, kind of.
Totally.
Interesting. I mean, it's a very complex problem, but I think thinking about it in that way maybe helps simplify it a little bit.
Yes. But here's the key to it. At the end of the day, right? All athletes, I don't care what sport, what is the one thing you have the most control over? Preparation, which is, do I have my ranges of the tissue ready? And your skills, did I actually do enough repetition? Did I load it properly enough so I can actually perform it? The performance is out of your hands. The performance is the test. You just go. But that's all you have control over, right? And obviously your nutrition, the internal system, hydration, sleep, and whatnot. But it's like, we try to do too many things, and the reality is we can't do as much as we think we can.
So I guess moving forward, it's tough. I guess I've always kind of thought it's not that hard to progress speed, strength, all those sorts of things. The hard part is doing it while staying healthy. And we've talked a lot about that, and there's not a lot of answers, but you got things to consider anyway. I guess if you have a healthy, quote unquote, healthy athlete, and you are trying to push performance, where are you looking first, or how do you, I guess, assess what is the next thing that they need in terms of performance, assuming they have range and they have control and all those sorts of things?
The big one is, and I had mentioned it earlier, it was like leg power. Where are they on that curve? Like, are you high? Are you low? In my assessments, I use RSI, Reactive Strength Index. It's a quick and easy. I use an app where it actually captures it for me, and the idea is that it's just like, okay, it's something objective. It gives them something tangible, so that they're like, oh, okay, I'm either getting better or I'm not. And then also too, then I can use that to make inferences on where are you in the force velocity curve, and with your age, what kind of strength am I actually trying to acquire to either build it, or no, man, like, you're pretty good. Like, how do we sustain this? Right? Because some kids are just like, they're naturally high. Some kids are not. So I want to know, okay, from a performance standpoint, I need leg power. Like you're going to need it regardless if you're a power athlete, like power lifter, or you're playing baseball. It doesn't really matter. So then it's just a matter of, okay, well, where do I put you on the force velocity curve? And then from there, it gives purpose to demands on the range and also gives purpose to the next step, right? And what kind of preparation you need to implement in that next step, right? Preparation will always change, or your warm up, if you will always change based on the next step. Your preparation in the weight room is going to be different than when you're on the field, right? Versus I'm injured. Like those are different. They'll have some common components and some overlap, but they'll be different. But RSI, like that leg power, I will start there. And then from there, it's okay, well, is this a speed-based performance or is this going to be a strength-based performance? Right? If it's strength-based, okay, can the chain actually move simultaneously? Yes or no? Can you control everything? Versus speed, where it's like there's more of a sequencing of events, then I need to make sure that, okay, you have those like coordinative capabilities, right? One's lower than the other, but it's just like, okay, now start to work towards that. And it's not looking at, okay, well, you're going to be a squatter, so let's look at your squat. Yeah, there's basic elements to that we can actually tease out, right? And then build it from there. So it's just like power and then demand on that curve based on the next step. And then, okay, what are the nuances of that particular performance that need to be integrated into it, right? So like, for example, like if you're into powerlifting, okay, well, everything starts at the ground. Your feet are on the ground when you actually lift, are they not? For the most part, squat and deadlift. So start with the ground, right? What do your feet do? And work your way up, right? Same with the pitcher. You're standing on the bump, right? You're ready to go. Well, what do the feet do? If the feet don't do what they're supposed to, the brain starts guessing. And so do you. And then the outcome thereafter is what you see. And that would be sort of my instinct going forward with an athlete, just take ground and start screening. And some of this stuff can be done in just Q&A, right? Do you have strong feet? Do you have stiff feet? Do you have ankle problems, right? And work your way up. And it becomes a very redundant Q&A going through each region. And you'll find out the nuances of various sports and body types that you see the same things, right? So for baseball players, for example, right? The one thing I'll ask about is hip control, right? And how stiff they are. And I find it really quick because then that gives me either I go up or I go down on the chain. Right? And like, I don't feel as like stable. Okay, I go down to the feet versus my arm just feels sore and I just don't feel comfortable. Okay, then I go higher up into the chain from the hip. But it gives reference points, right? So, but it's also too, I think, with the assessments, like we were talking about specificity, having somebody assess who actually understands the sport is also really important to that conversation piece we're having right now. If you're not in the track and field world and you're into swimming, you better be careful, because if you don't really know the nuances, you might be creating conclusions that are not appropriate or misguided. And it's not due to ill intent. It's just you're naive to some of the nuances, right? I do a lot with baseball and I do with some of the lifting, things that I am comfortable with and I've spent a lot of time with. You're not going to see me evaluating gymnasts and their technical. I can't do 99.9% of what gymnasts do, nor am I a swimmer. So I'm not going to make a lot of those assertions with those types of athletes. I'll stay within my lane, but it's like, that is the key. And that's where I think most success is had on these assessments are people that actually know the sport and know sort of like age specific sort of tendencies, especially with trainers. Like it's probably one of the toughest jobs because they get a full spectrum of athletic, general population, health concerns right across the board. Right. And you got to be versed in that stuff.
I really like that general overlay though, where you talked about using RSI as sort of an indication of where do we need to go. And now I'm looking on the force velocity curve, because I don't think there's any sport in this case, because we're talking sport and athletics, that wouldn't apply to. And then like you mentioned, you need some sort of an expert or someone who's familiar with a particular position or event or sport in that case that can then maybe help guide you with that. But I really like that sort of general plan, because I think it can be applied to a lot of different settings and to a lot of different people,
Totally.
and makes it really easy to know where can I take care of this. And then, like you said, where do I need to go pull some outside help to
Yes.
kind of put the final pieces into the puzzle.
Totally. Yeah.
So we're just close to wrapping up, but one, I guess,
We're
final
just getting
thing.
started, man. We're just getting started.
There's so much we could talk about.
Well, that's right. I mean, I feel like we're going to end this podcast with more questions than we started with, but
Well, that
we
usually
talked-
means we learn something, right?
oh, yeah, I'm gonna have to
So-
go back, listen, take notes, and
Yeah.
but we talked a lot about we need range and we need control of that range and varying types of control for sure. Is there any like principles or like, I don't know, how somebody who doesn't have your level of expertise, how can they start to accomplish some of those things?
Yeah. So here's the key to it. Basic skill set toolbox for anyone who deals with the human system. Number one, know your anatomy. If there's anything there that I can make comments on, it's like really understand the anatomy. Like, how much range should that a hip have? How much range should an elbow have? And then from there, understand your neurophysiology, right? Bernstein's a great sort of starting point on that. And then from there, it's like, understand your exercise physiology. Like, those three areas right there cover a lot of basis, right? And then when it comes to range, well, it's like the general principle is, it is the most basic outcome measure, biometric, if you will, of competency in the system, right? It's like ground zero, right? So if you're doing things right, and here's a point to it, guys, and I say to all patients is, it's either you can get range or you can't. And if you can, is it because it's injured, or is there something structural, or is what I'm doing not the right tool, right? The body's very straightforward. If you give it the right information, it'll do whatever you want. Contrary to what people will talk about with, oh, I'm stubborn, I can't do this, I can't do that. No, the body will do it if you give it the right information. So the point is that there's an endless list of tools. Like, I come from a therapy and S&C background, so I can throw a whole bunch of things at it. So if you want to use a lacrosse ball on a hip joint and you want to get range out of it, knock yourself out, go for it. Can you get all that range? And more importantly, though, can you keep it? People always forget that next step. It's like, you foam roller, lacrosse ball, you get, do some different techniques. You do cars, you do PNF, you do whatever you want. That's great, but can you keep it? And I think that's the question that gets missed a lot of the time. It could be loading. Maybe you just want to squat and just get range out of it. Not like fantastic, right? You'll know if it's actually the right stimulus tomorrow, and 5 days from now, are you keeping it still? Right. So, and there's, you know what, guys, all of those solutions I just listed are the right ones to the right person. Question is, do you have the right person in front of you with the right tool? And that's the assessment side. Right? Because people get debated like, this technique is better, this approach is better. No, they all are better if you have the right person with the assessment done properly, right? Which is determine like, what state is this person in, right? And that's where the science world is. There's no one technique that's better than the other, right? And people have their sort of biases, but no, like there's times I'll change up how I go about things, getting range. I might do Acu, I may do ART, I may do Mulligan, I may do, okay, just do this drill for me. I may put voodoo band around, like it changes. Just part of it is just because, you know what, I just want to test it out. But also too, it's just like the brain's capability with Beaver's axiom is like the body doesn't operate in isolation. So you should be able to create a variety of ways to stimulate the body to make it change. That's how it survives. Right? It's not born inherently degenerated where it just reduces options. That's not how proprioception works. So work with what the body actually is capable of doing neurologically.
I really like that takeaway that you mentioned at the start where, hey, understand your anatomy, have an idea of what's going on from a neurophysiology standpoint and an exercise physiology standpoint, because I think what you've highlighted there is some of the common language and common things that you would need to know, whether you were a sport coach, a clinician, a
Yes.
strength coach, whatever. And that would allow, for example, you and me to have a conversation about something. And at
Yeah.
least we both know we're bringing A, B, and C to the table. And that's a common language we can use to communicate, because there might be something I can't do, but now I can effectively communicate with you to use your expertise in a different way. And I think that's a great takeaway for anyone in the sport world, to understand those things.
Totally. And I think that's where part of the issue is like language, right? We use titles to dictate language. No, it's like, it's the human system. Here are the subtypes on topics, go, right? That is like what sort of interdisciplinary, integrated sort of knowledge dissemination and implementation are all about, right? It's just having everyone versed in the same topics, making sure that they're like enough breadth of knowledge is there, not just a superficial one. And that one's, it's always a challenge, right? So it's, and that's the pursuit of trying to be better.
Yeah, definitely 100% agree with all of that. I know personally, the most valuable lessons I've learned, in conversations with you or conversations with other coaches have honestly been anatomy lessons. And you just understand the system you're trying to influence so much better. And you can solve so many more problems that way. You have the concepts, not, the lessons. And that way you can apply it to a broader scope. Talking about the, it's the right tool for the right job if you have the right person in front of you. I find a lot of people have the same conversation around music. People like to say, this band's good or this song's good or whatever, but it doesn't matter. Everything's good as long as the person listening to it likes it. So, great way to end a good chat. What are you listening to these days, Robb, or in general?
I listen to a lot of stuff. Like I don't have one genre per se. It's based on my mood. But like I like my country. Something I like acquired later on in my 20s.
Laughing at me. He knows I don't like country, and so the smirk on his face as soon as you said that.
Oh,
Tommy
nice.
hates it. I was waiting for this part.
Yeah, like you know what, like it all came about doing a lot of like hard ass landscaping, working with a lot of farm guys. So it grows on you a little bit. It wasn't like the achy breaky heart stuff. I'm not into that stuff, but I'm a big Eric Church fan. Like he's a bit of a blue collar guy. But it's I like my hip hop as well. Like I'm old school hip hop, like Nas, the guys of that nature and that sort of era. I also like, if I'm working out, I'm a DMX fan. I grew up in that era. Nice. So it's but it's all based on mood though, right? Like but for the most part, like if I'm driving around, like like you got Eric Church, like Florida Georgia Line, like a lot of those guys, I just like that beat. It's easy enough. It's not harsh. I got young kids, so I got to be selective on sort of the music I have. So it's because my kids are pretty keen listeners, so I got to be careful.
No DMX in the car.
Language. What's that?
No DMX in the car.
No, and there's not too many like clean versions, we'll call it. So
no.
God bless his soul. I know he's passed away, but it's just, like you're right though. Like music is a big thing. Motivate, especially in the training world, like being with a lot of athletes, it's really impressive to hear and what guys will resonate with. And like when you got 8 guys in a room, man, it's just like music is a hard thing to come to a consensus on. So it's just like, because it's personalized, right? Like Tommy, you don't like country that much. So if we're in the same room lifting, like we might be on the other side going toe to toe at some point, but at the same time too, though, man, it's like, I get it. Right. And it's like, and that's the thing to it as well. Like with training, with music, and we make a full circle, it makes a huge difference in the environment for guys getting after it. If it's the right ambiance, music, the actual environment, whatever it may be, that goes a long way. And I think that is understated a lot of times. There's research out there, and it's and that's the thing to it, right? Like if I know I'm going to a room and Tommy's in the room, I'm versatile in my music, I don't mind listening to what he's got going on, right? I've trained enough athletes in my day to sort of acquire that skill. I'm good with it, right? I mean, I don't necessarily like it and listen at home, but you know what, man? Like if it means you're going to get after it and I can keep you healthy and sort of everything's good, why not? So it's that's what I'm listening to these days. So Tommy, when we work out, dude, full country.
Oh no, It's funny you talk about
That's-
mood. Like I always talk to Braden when I want to. I love my heavy metal music, so if I'm doing a lot of strength work, I
Yep.
love to blast that stuff. But if I'm out on the track or if I'm doing something that's a little bit more speed based, I need something a little more like up tempo or
Yeah.
rhythmic and flowing. So that's where I love to go to my sort of like EDM or like electronic music that I can listen to for that
Totally.
stuff. So it's cool that you mentioned that. But even about the mood, I've just moved back from Edmonton to be back home in Ontario, and I'm in a good mood. I've been able to see friends and family that I haven't seen in a long time. So the music I've been listening to this past week since I've been home is definitely more upbeat and happier and just kind of good stuff like that. So I've been finding my way back into a little bit more um like EDM or dance type music, but
Yep.
just like I'm trying to think of some. I just had mixes playing, but more upbeat type of stuff,
Yeah.
and so I've been enjoying that. So a little bit of a change of pace for me, but
It's good though,
still in
man.
the
But
electronic music category, which I like.
totally. And it's like I grew up in the like I'm older than you guys, man. Like I grew up in the 90s, right? So like that your dance stuff, like man, I grew up on that stuff. That's how like when I started working out, man, like that stuff was blaring. So my brothers and I, we always joke like nobody listens to this stuff, but like that's what gets us going, right? Like not everyone does, but hey, it's just and part of it too, guys, it's experience, life experience also parlays into a lot of what we do. And I think that's where the music comes into play too, right? Like it's an extension of you at the end of the day, right? So if you're real and you're authentic when you're going to train and when you're trying to get after it, that's when you see the best performances out of people. Right. And you see it all the time when on TV, when they're showcasing athletes, like they got their headphones on, you know that they got their own music. Like they're in the, like they are themselves when they're on stage. Right. And that's the hardest thing to do, right, for athletes, because you think you're something else. And no, like you got to be you to stay real. Right. And sort of have any sort of longevity. So it's good.
Braden, have you been you this week, or are you still exploring the palette of all the different music you've been on recently?
Yeah, it's tough. I try to find like new things to listen to every week to keep it fresh for this show. But today, actually, or yeah, today and earlier this week, I was inspired by Robb, and I knew you were going to bring up the country. So I was driving with my brother, and he had a song on by Chris Young that I really, really like. And then I showed him a song by Billy Cunnington that I really, really like. And then earlier today was I was playing the summertime or country summer vibes playlist on Spotify, and it's all the good. Like I didn't get very far through it, but I'm sure Eric Church is on there and like Luke Bryan's on there.
Yeah.
All the hits, and yeah, all those kind of like rock, pop, country. It's all in the middle of that. That's my jam.
Yeah.
Sure.
So yeah, it's all kosher and like especially my family world. So it's yeah, you gotta be careful with things. So it's all good though. All good.
Yeah, controversial, but as long as it's not too controversial.
Yeah.
What I'm learning is everyone's on the country train except for me.
Yeah, apparently.
Hey,
I'm on the
dude, just give us some
platform
time,
watching the
man.
train go by.
Give us some time, dude. Give us some time.
That's true. I mean, that's a good point. Like it I don't think it's ever anybody's first choice, but it grows on you and then it becomes your first choice. So you got to give it a
Yeah,
chance.
it's in certain circumstances, yeah, for sure, right? Like I couldn't stand it as a kid, right? So it's just yeah, it's one of those things. So yeah, soothes the soul, man. Soothes the soul.
But yeah, that was a great chat. Can't thank you enough for coming
Yeah,
on.
that was awesome.
Yeah, man.
Sharing
Anytime, guys. Anytime.
your insights. And I mean, don't threaten me with a good time. We'll have you back at some point then. But in the meantime, is there anything that you want to plug, point people to, or if you want to have people get in touch with you, whatever, anything you want to share?
Yeah, man. It's first and foremost, guys, thanks for having me. Great conversation, good chats, man. For me, it's like, you know what? I'm at the Armory here in Waterloo. I do a lot with athletes in general. Yes, I do baseball, but it's I try to take pride in having that sort of best interest in athletes. So those trying to get out to me, I know I might be busy, but I'll always make sure that I get athletes in. But if they want to get a hold of me, Dr. Robb Gmail is probably the best option for it. I'm not a big social media guy, but it's I got a good following, but it's just, you know what, it's one of those things where I think I got to sort of like get into the modern times on things anyways. But yeah, so anytime athletes of any genre or sort of population type, it's to be a good therapist, you need to be able to sort of address all population types. And I think that in my 15 years, like I try to make sure that it's not just athletes, because everyone's an athlete at the end of the day. There's my plug.
Yeah, that's right.
Yeah.
That's right. Anything from you, Tommy?
No, I'm happy to be back and recording again. We had a little 2-week hiatus and I missed it. So it's good to be back.
That's right. All right. Well, thanks for coming along, world. That was the Speed Strength Show.
We will see you next time.
Peace.